People don't realize that dentists are one of the sickest people. I've been a dentist for 30 years. You were the first guy that we met that really understood that if you have toxicity brewing from the oral cavity, I can't detox you.
Your teeth literally are neurologically connected to parts of your body.
If there's an infection in the mouth, it could be dangerous. It could lead to your heart and you could die.
80% of chronic disease starts in the mouth. Amalgam fillings, they're the silver fillings that contain 50% mercury. A lot of people don't know that. And the ADA, the protective body, the American Dental Association would say, oh, it's fine. The mercury doesn't come out. It's safe. Then they said, well, it comes out, but it's too little to matter. These amalgam fillings are banned in most countries in the world.
2 states have banned fluoride. It's something that you're putting in your body should not at all have any level of toxicity at any amount.
Do you believe a root canal could be done safe? I can't wait to do this podcast. Smile Body. Okay, these are the dentists that we absolutely love. I can tell you this, you're going to learn a lot about dentistry today. Now, that sounds so boring, doesn't it?
Okay, well, it's yeah, I mean, the thing is, it's more about whole body health and the gateway to how the mouth is the gateway, right?
That's right. Here's where I would start. Could your headaches, could your fatigue, could your bizarre symptoms, your gut problems, your anxiety, your sleep problems, could that all be linked to your mouth?
Absolutely.
Exactly. That's what this show.
That's how we just started.
That's what this show's about right here.
Yeah.
I talk about it all the time.
Absolutely. And the answer is yes.
Yeah.
Okay. We're going to peel that
It
apart.
happens all the time.
Yeah. We're going to peel that all apart because obviously I don't say this to brag or boast, but I believe that I am the number one referral in the world for dentistry, not just dentistry, but holistic dentists, and not just holistic dentists,
100%.
but dentists who understand what cavitations are, the dangers of root canals, and all of those things that we're going to talk about today, because even holistic dentists really don't understand cavitation and some of the topics that we're going to discuss today. So we're going to peel it apart.
I have to tell you, I always talk about the fact that you were the first guy that we met that really understood that if you have toxicity brewing from the oral cavity, I can't detox you.
Correct.
You always talked about this. So I kind of resonated with you about that. I'm like, oh my God.
Yeah.
If there's toxicity coming from the oral cavity, you can't do what you want to do.
Absolutely.
Functional doctors can't do what they want to do. So,
you learn things in life, right? Through stories and things that happen. And when I was taking on clients myself, very, very sick and challenged people, I remember reading about these hidden infections in people's mouths that they didn't know were there, no pain, no symptoms. And when they would get this cleared up, they would gain their life back. So lo and behold, having this person in front of me, and I'm dealing with a very unexplainable illness. They went everywhere. They went to every doctor, spent all this money. They had money to spend. And I said, well, you know what? Let's go down that route, right? Read a lot about it. And this was many, many years ago. And so I sent her to a dentist who found 2 root canals that they took out, both of which their dentists were like, they're fine. They don't need to come out. But this person was like, no. We're doing everything the right way. Take them out. And found 2 severe cavitations. And you're going to hear more about what that actually is. And cleaned it up and got their life back. I've been a believer ever since.
Well, it's the human body is amazing, and our natural ability to heal is actually inherent, right? But unfortunately, we messed it up.
Yeah.
As a society and as dentists, we have messed it up. We've put in so much toxins in the body for the sake of technology, for the sake of convenience, for the sake of saving the tooth, and we're for the sake of saving the tooth, we're disrupting the system of the body in so many different levels, and not just infections.
You're right.
Not just heavy metal toxicity.
Nerve meridians.
The nerve meridians are so huge and overlooked in the medical world completely. I texted you about Simon Yu. I want to tell you more about him. It's something more and more like as we are evolving, and that's one of the good things about biological dentistry. Like one thing that we're all about as far as biological dentists is that you cannot be the same dentist you were last year.
Mm-mm.
You have to keep evolving because that's the world.
It is. Yeah. I mean, that's what's great about you guys. You keep evolving. All right. We're going to peel all that back because you just have those watching this. No, because so much it's estimated, okay, that 80-some%, I've heard 82, I've heard 84, 86, 80-some% of chronic disease starts in the mouth. Okay. Now, many years ago, I'd be like, what are they talking about? I don't even understand such a thing. Okay. It's real. It's true. And we're going to peel back all of these things that are really causing sickness in so many people, unknowing to them. Again, no symptoms in the mouth. My mouth's fine. My dentist says my mouth's fine. Oh, but it could, in fact, be making you sick. I think, and this is no slight on dentistry, because I think that as dangerous as it is and damaging as it is, it also can be the game changer and the lifesaver. So I have all the appreciation for dentists. But that said, I believe dentistry has caused more disease than, than any one profession, right?
Sure.
And is it true that dentistry is the sickest profession? I saw the sickest, most suicide, right? Most suicide rates.
Me too now.
Number 2, that's right. It was number 1. Now it's number 2. Who's number 1?
Anesthesiologists are number 1.
Anesthesiologists. Why is that?
I don't know.
Yeah.
But if you think about the dentistry, it's obvious. Because of all the heavy metal toxicity, think about the neurological disorders, right? You know, personally, the amount of toxicity that we're burdened with in the world of dentistry constantly, with the fumes going on, not just mercury, like all those toxic fumes that were just constantly around. It's building and building this load, a burden on the body, neurologically, physically, sick. It's just it's huge. And then our poor patients that
well, and then this is another stat. Tell me if it's true. Women working in dental offices number 1 in fertility. Number 1 in infertility. I mean, I link that directly to mercury vapor
too.
Yeah.
So I always talk about dentistry just wants to get you functional. And if you don't have pain, you're doing great. The problem is that they aren't looking at materials.
Mm-hmm.
What kind of toxins are you introducing into the mouth?
Yep.
And how are you removing toxins out of the mouth? That's the dentistry.
No doubt. Okay, we set it up here. I mean, we set it up. But I want to actually go backwards in a minute, right? Because these guys are brothers, all right? Dr. Ben and Dr. Shawn. And, I mean... For 2 brothers to end up in dentistry, I have to hear the story. You know, first of all, let's back up. What do you think in your childhood? It's going to be probably 2 different answers, right? You were a dentist first, right?
Yes.
Okay, so you're the older brother. I already know that.
Dog.
But yeah, by how many years is my question?
7 years old.
7 years. Okay. So we'll start with you. How did you end up in dentistry? What happened in your childhood to cause you to be a dentist? It sounded so bad.
That's a great question. I mean, to be honest with you, I was in high school and I had no idea what I was going to do. I was kind of stressed out. I'm like, what am I going to do? You know, and I loved my dentist at the time. I used to go to, it was a family friend, Dr. Rod. Yeah. And I would go there to my dentist, and he was a great guy. Great personality. He had a small little office, and
I got my mercury fillings with him when I had mercury.
Yeah. I had my story there too. Yeah.
Sitting there, and I'm like, you know what? One day I was 17 years old or 16, somewhere around there. I'm like, you know what? I think I can do this. I love this. He's his own boss. Great guy. People love him. And I was a dentist, and people loved him. It was kind of weird. And, I'm like, I think I can do
because people are afraid of dentists. They're scary, aren't they? Yeah, I mean, the Javid brothers, they look really scary.
And I'm like, you know what? I think I want to be a dentist. So I asked him, I'm like, do you mind if I can watch you and come and volunteer and kind of see how it is? He goes, sure. So I went to his office, and I sat down. I would assist him and kind of suction and kind of see what he was doing. And I'm like, I think I like this. I want to do this. So I kind of asked him to write me a letter of recommendation of what I was doing when I was in college, and I never looked back.
So it's funny you said that, because that was my story, right? My neighbor, my best friends growing up, we grew up on the same street and, did everything together. Their father was a dentist, Dr. Soster. And I was like, man, I loved the lifestyle he lived, right? He would go hunting all the time. He had his own business, and he's making people healthier, like I could do that. Like I was good with my hands, frankly. So I knew that I could be a really good dentist. And so I just kind of lived vicariously of like, I could do this. So literally you guys don't even know this, right? But and by the way, we know each other very well, folks. So, but thought, okay, I'm going to be a dentist, right? And I started college to be a dentist. I was in pre-dental at University of Pittsburgh. Did you know that?
You didn't share that.
Yeah. Okay. Yeah. I don't share that with many people, but maybe that's why I know so much about dentistry. But here's what happened. Then I did the opposite. I went into a dental practice and I was like, oh yeah, I'm not doing this. It was like, all of a sudden I realized that I just didn't want to do that. I didn't want to spend, sorry guys, I didn't want to spend my life in this position looking in people's mouths all day. So I bailed on it. But okay, what's your story? That's our story. He ended up a dentist. I bailed.
Well, I had the benefit of Shawn being my older brother and get exposure through him. But what happened was in high school.
So wait, back up. Did you guys have a great relationship growing up?
Yeah. Well, because we were 7 years apart.
Yeah.
I was kind of like his dad almost.
Yeah, that's a good number of years.
Mentor.
If it was 1 year apart, you might
competitive.
Yeah, exactly.
So, growing up, I mean, I was kind of like taking care of him a lot, right? And then, so when I was...
He taught me to ride my bike. He taught me to drive. He taught me about girls, how to dress, and all that kind of stuff. It was him. It wasn't my dad.
So we have you to blame.
Yeah, right.
For all these things.
And let me tell you what happened. There's an interesting story. So when I was in high school, I took an anatomy course and I was like blown away. I'm like, oh my God, this is amazing how the human body works. I want to be a doctor.
That's really probably how I ended up wanting to be a doctor.
This is where I'm meant to be. Like I was, I did all right in school. I aced that class, like by far. It was easy for me. It came easy. I loved it. And, then what happened was, I'm like, Shawn, I'm going to go to medical school. And at that time he was in dental school already. He was 7 years ahead.
I was in my residency.
Yeah. He's like, no, you shouldn't do that. And I'm like, wait, what do you mean? I love it. He's like, you know what? You're an artist. I like to draw and paint and all that kind of stuff. He's like, you're good with your hands. You love that, the sciences. You'll be a great dentist because you're going to be, this is going to come so easy to you.
Yeah, he's like, no. He's like, I'm not going to be.
He's like, no. He's like, just come to my school a little bit, check it out, go to start. I'm like, okay, fine. So then I went and checked it out and I started volunteering at UCLA for a while and checking it out. And it did resonate with me because it kind of combined both the sciences and the physiology. I became a physiology major at UCLA. I loved the anatomy physiology component, but then the artistic side component, I loved, you're like an architect, you're creating, designing, and there's smiles, and then there's the people interact. I love the people interaction.
Yeah.
I'm,
you both have that.
They don't tell you this about dental school. Unfortunately, people get there and you're not good with your hands. Or you're stuck.
Yeah.
So we were lucky because our dad was an artist, and so it was easy for us.
He's not a dentist. A lot of people ask.
Yeah, exactly.
And so dental school came really easy for us because we're just artistic.
Yeah.
That's why I'm like...
the best, Dr. Jerry Curatola, he was an artist and he was a sculptor at one point. And so there's obviously that, right? To be a really good dentist.
Hands.
Yeah. And then, but you have to be good with people too.
Yes.
I think that's any doctor. I mean, at least if you're,
and
dealing with the public.
And you have to run a small business. That's no joke too. Exactly. I mean, you're like, listen, you're running a small business.
Oh my gosh, right?
So you have to understand, Matt, like when we started, actually 20 years ago, we started our original practice together 21 years ago now. And I was a kid, I was like 25, 27 years old. And then, and I'm like, how am I going to be running a team? I don't know anything about it. So I started reading leadership books, management books, like, okay, this is concept of leadership, concept of, how do you, and everyone was older than me. So I'm like the kid I was the youngest person in the office.
Yeah.
So now, and I'm the boss, So I had, so there's all these different hats you wear.
Yeah,
there's the psychology behind it.
It's true.
So for me, actually, I flourished in that, and I really enjoyed kind of bringing the best out of my team and like connecting with my team, connecting with my patients, and really having a positive impact in people's lives.
And I was by myself at that time for 9 years. By the time he came in, and then we started practicing together, and dentistry, and that's where the suicide rate was so high. People would ask us, it was because dentists have to wear so many different hats. And they don't
Not to mention the mercury toxicity.
Yeah, exactly.
There's that too. There's that too.
The Mad Hatters.
they don't teach you this. You just come to your doctor.
Yeah,
And
there's a lot.
And by the way, chiropractic, other medical professions are very similar, right?
Similar.
It's like, it's like they don't teach you anything, and here you are just trying to put it together yourself, and it doesn't end well a lot of times.
No, but we were lucky. We both in dental school, went to the same school at different times, and we both just flourished there at the times we were there, and we both came out like very, very confident in what we're doing and who we are, and not knowing that we didn't know anything. We thought we knew everything.
Oh yeah.
Coming out of dental school, both of us separately were very confident, thinking like we're the best. We didn't realize we didn't know anything at all.
Yeah.
And now it's like we don't do anything that we learned in dental school. We do everything completely different.
I could repeat that story as well. But okay, so you come out of dental school and you're just doing regular dentistry, right?
Oh.
I mean, you're drilling amalgam fillings
Every day.
out, right? Every day. Yeah.
Every day.
And you're using them. And just for people listening, that amalgam fillings, they're the silver fillings that contain 50% mercury. A lot of people don't know that, but they do. And the ADA, the protective body, the American Dental Association, would say, "Oh, it's fine.
Yeah.
It's just the mercury doesn't come out."
No, it's
and then
amalgamation.
exactly. It's amalgamation, doesn't come out. It's safe. And then they said, "Well, it comes out, but it's too little to matter."
Yeah.
And then it went down, and we'll get to more of that in a minute. But okay, so you were doing regular dentistry.
Crowns, fillings, root canals,
all of it,
everything. And we got extra training in doing we got advanced training in general dentistry. So we started doing full mouth reconstruction surgeries, or every tooth had to be restored. And from a young age, we just said, he did a residency.
I was doing surgeries all the time. I was advanced root canals all the time.
Yeah.
I mean, anything you can think of, I would do.
We pushed the envelope.
I love dentistry so much,
Mm-hmm.
And I sat down. I did it exactly the way they told us to do it.
Yeah, and at this point, you had no idea any of it was bad.
No, of course,
no idea.
We just came out of school. So
right.
School, our professors are, they're like, oh wow, they taught us everything about, like you said, root canals and how to do them perfectly to the tip of the apex.
And you were taught all root canals are safe. They're good as long as you do them right. Amalgam fillings are safe, right? No problem. Yeah. Just take out wisdom teeth. No issue potential once the teeth are gone, right? I mean, this is what you're taught. And would you say most dentists believe that still, right?
Oh, 99.99%.
9.99% of dentists still believe
Maybe
all
not the
that.
mercury fillings.
Okay.
I think mercury fillings.
Yeah, I agree.
We've made some shifts since 20 years ago.
But that's a great question. So
very little maybe with that too.
Yeah, right. So what percent of dentists do you think go, amalgam fillings are bad?
Depends
mercury
on what part
bleach.
of the country
Okay.
you're in. I think California,
more.
West Coast, they're going to be more, it's bad. And the East Coast, actually our friend Jigger, he's there. He's
Jigger.
Yeah, Jigger.
Yeah, he's one of our dentists in New York. Great.
So Jigger, great guy. And he even said I don't really post that I'm smart certified that much. I'm like, what do you mean? We were just hanging out at that that course I was just telling you about. He was there too with Dr. Simon Yu.
Yeah.
And why wouldn't you not boast about how you're smart certified and doing it safe and removable? He's like, I get so much crap from other dentists. We're like, what do you mean?
Wow.
So on the East Coast, it's more like there's nothing wrong with amalgam.
It's so crazy.
And then on the West Coast,
I would say overall, most of the dentists in the country, they don't think there's anything wrong with it.
Wow. That's amazing. And yet it is so, it's been out there so long, so many years now.
It's almost funny
that these fillings do leach mercury vapor. The vapor of this mercury comes off of those fillings, crosses the blood-brain barrier. It's part of my story. It's part of my perfect storm, how I got sick.
I'm like you.
Yeah.
I went through my whole illness. I got sick from that. So what happens is that when it's in your mouth, it's releasing vapes all the time, hot and cold, chewing on it, right? When EMFs come in.
I
more
videos of when you're holding a phone to the ear, okay, or whatever, even here. We know now that it's signal you become a human antenna with that metal in your mouth.
Yeah. And more mercury is released.
More mercury is released, and more radiation because it's conducting into you. So this is a new problem.
And not to mention, again, you were talking about how many dentists know. Think about it. In Russia, these amalgam mercury fillings were actually outlawed in the 70s.
Yeah, 72.
And then in Europe, many countries have banned it. I think actually 2025, all of Europe has banned it. So it's not like unheard. I mean, why the U.S. is still, but we can't let it go down the drain.
Right.
That is a regulation. It's not allowed to.
See, that was one of the things that always irks me is that, okay, so OSHA, which is, again, our protective body, right? It's like, and they would say on the dental tray, it's considered a class 3 toxicant, right? I mean, this is hazardous waste.
Hazardous waste.
It's considered hazardous waste on that dental tray.
Go down.
The moment it goes in your mouth, they call it safe.
It's fine.
Yeah.
The moment it comes out again, now it's hazardous waste again.
It has to go in a special trap.
Yeah, it has to go in a special trap because they know the dangers of this filling.
Environment. Yeah.
Right. And yet I argue it's safer on the damn dental tray than it is in our mouth because we have an acidic environment with chewing. Look, anybody out there can Google for fun the smoking tooth video, right? That's a 25-year-old filling. And I say that because the ADA's argument at one point was, oh, they're too old, or, don't worry about these old fillings. Many dentists will say that, right? No, that's a 25-year-old filling that they just rubbed with a pencil eraser on a fluorescent screen, and you see mercury vapor pouring off of that. That's going into the brain.
When you drill on mercury, 3,000 microns per minute come off.
Yeah.
Odorless, tasteless, right?
Yeah.
When it touches your skin and hair, it gets absorbed into your body.
That's right.
People don't realize it.
That's right.
That's how I got sick.
That's how I got sick.
Yeah.
Yeah.
I had my own journey. Right?
Yeah.
And you've helped me. And so the thing is that, people don't realize that dentists are one of the sickest people because
these guys are doing my brain phase, have been.
Yes.
Because how much of that went in your brain? A lot.
Imagine, I've been a dentist for 30 years.
Yeah.
And the first half of my career before I was a biodentist, I was taking on mercury fillings all day long. Just drilling on them, exposing my patients. Yeah, exposing my patients, exposing myself all day long.
Yeah.
Right? And I had no idea, like you said.
Did you ever feel suicidal? I mean, because this,
I did not.
But you got sick.
But I got sick.
Yeah.
In 2016, I got really ill, from just toxicity.
I felt suicidal. I mean, meaning that I can't say I ever planned it, but I definitely wanted to die. My wife was worried about me. One of the classic signs of mercury is the psychosis that goes with it, right? You lose it. And then the unexplainable anger had it all.
Yeah.
Just weird symptoms, even like this, weird thing like that happens with the heart pain. It feels like angina, but it's not. And on our questionnaire, one of the things is, heart pain, if you're under the age of 45 for no reason, people go to the doctor and go, yeah, they don't find anything. Well, that can be a mercury sign, right? Irritability, sound, noises. I mean, all these things are mercury, right?
Hormonal imbalances.
Hormone imbalances like crazy.
Thyroid issues.
Like crazy because it goes right for those receptors.
What we want to make sure to always have the message out there is that please don't go and just take out your. A lot of times people listen to this.
So important.
I'm going to go take out your mercury.
So important.
Oh, it's bad for you. I'm going to go take it out. And I always want to follow that up. And I've done, you've done videos.
But by the way, that's what sent my bucket overflowing.
Yeah, of course.
Yeah, right. I was accumulating mercury from the time I was a kid. I always quote the Drash study, which is a German study. The number of silver fillings in mom's mouth is proportional to how much mercury they found in the baby's brain. That's on autopsies, right? So that's where it starts. So my mercury was accumulating because my mother had fillings. And then I got 2 fillings out. And one of my good friends did the work, right? He wasn't trying to harm me in any way. And fatigue started, but I never associated it. It wasn't until 3-4 years later that a bright endocrinologist said, I think you have mercury toxicity. And I said, I thought so too. A year before I did a blood test. Oh, that's the wrong test. It won't show up in your blood. That was, if you were getting exposed every day, it would, but it's works its way out of the blood.
It's so important to just, that process is what overflows the bucket.
Absolutely. And so that's what happened. He drilled them out. And it was that overflowed the bucket. I got sick.
And so please out there, anyone listening to this, do not go take out your Mercury.
Yeah, that's the important one.
You have leave them in until you do it the right way.
Absolutely. And these guys, tell them where you're at and where they can find you. Go ahead and do that now because people are writing notes.
Well, we're in LA area. We're in the LA area. You can find us at our practice name is Smile Body.
Yeah.
But our handle on social media is My Smile Body. Our website is mysmilebody.com. But again, you have to do it the right way.
Yeah.
And of course,
and so many patients come in and when I talk about you, actually, they're like, "Oh, Dr. Shawn, don't worry about it. I took out the mercury films a long time ago." I'm like, "Oh my God, that's actually a lot worse."
Yeah.
They're like, "What do you mean?" I'm like, "You got exposed."
Yeah.
And these are some of these symptoms that you're having. It's probably from the mercury. And if you go to a functional doc right now, you do a blood test on you, it's not going to show.
It's ridiculous. Yeah. Or they just do a regular urine test or they do a hair test, all of which is useless. Yeah, sure. But the fact is to the point, many people watching this have had their fillings out. What they don't realize is that mercury vapor crossed into the brain. And that mercury is locked there longer than they live. I mean, the half-life's longer than they live. So they go, "Oh, no, methyl mercury has a half-life of, what? No. That turns to inorganic mercury, and it will not come out of that brain unless you, and this is where we team up because my protocol is, my brain phase is what I'm known for, of how to get it out of the brain safely. But you've accumulated.
Amazing protocol.
But we got to get the source out.
I love what you do because it's incredible. I mean, I have so many patients come to us that they've been seeing you, and we're trying to assess their oral cavity, and they're like, "I feel so much better being done."
Their lives changed.
So, and then by the time they get into the brain phase, they're always saying, "Oh my God, I'm feeling so much better." So thank you for what you do because it's there.
But we need more dentists around the country doing this work,
well,
right?
One of the things on the brighter note, I mean, we're talking about some of this dark side of dentistry, but the brighter note is there's so much positive momentum happening right now. I mean, you feel it every day right now with Bobby, and what we're seeing is there is a shift. I mean, now 2 states have banned fluoride.
That's amazing. Utah first. Right here.
Utah.
Yeah, exactly.
Utah and Florida.
Yeah.
And so now Utah and then now Florida. So that's going to keep going. That's not going to stop. Mercury amalgam is next, I guarantee you. And we're part of actually, see, on the other side of things, we're working with biological dentists actually internationally on creating a certain standard. We all talk. We're
so good.
And creating not only a standard of what's acceptable, what is biological dentistry, what is the correct way to hand manage cavitations, because people are all doing as you know, you people are just doing their own thing, not knowing what to do. So we're creating a standard internationally, and then also legislation. Us grouping together to kind of push legislation, getting caught up to the rest of the world. The U.S. is so behind in these things.
Just like the food dyes, right?
Yeah.
I mean, all of it. But dentistry is way behind. I mean, like I said, these amalgam fillings are banned in most countries in the world, right?
Yeah.
And then here, of course, we don't want to put them in pregnant women or children. Well, children, they put them in.
They do it for everyone.
Yeah, they do it for everyone.
Women,
but isn't there like at least some warnings about that? Nothing. No warning at all.
Nothing.
Wow. No, that's amazing to me.
It's crazy.
Yeah. And they'll tell women not to eat fish, but amalgam is way higher the amount of mercury than any fish exposure.
I just told you 3,000 microns per minute comes off. That is huge amount.
Yeah. I mean, it's like eating tons of tuna. I mean, come on.
So the good, again, I'm always very optimistic. You know me well. I'm always like looking at the bright side. And so I'm super excited about this next chapter of wellness. And because, you've been on this mission for quite a while. And for us, one of our biggest admirations right now is really changing how healthcare is being done. And in starting with this collaborative process that you've created, that you're doing with dentists right now, this is what we believe is the future of healthcare in general.
I agree.
Is this collaborative approach. And Smile Body is actually, the name Smile Body means the mouth-body connection. And so we're excited about what's to come right now. Is this next chapter of health and wellness with, again, the help of Bobby and what he's doing in the government and everything. So now what we can do together, more and more relationships like this, naturopaths, integrative doctors, all working together with biological dentists that understand this standard.
That's how we're going to make America healthy again.
This collaborative approach, and stop treating people as like health issues in silos. The heart doctor, I don't know if you know about this, one of our patients, when I talk about the heart doctor should not just be looking at the heart. Okay, right? If there's a heart issue, you should be looking elsewhere. Okay, one of your patients, when I say yours as in a Pompa patient through the program, she had been going
It's crazy.
to heart doctor for heart palpitations for 20 years. Okay, she flew in from New Mexico to our office, and we did an assessment on her. She had massive infections around the third molar regions and all the molar regions.
Did she know she had infection there, or was that after you looked at the cone beam?
She had been told here and there, but no one had made a big deal of it.
Okay, got it.
She was scared to do the surgeries. Okay, so we work with meridians. Okay, meridians, if most people don't know, are the natural energy lines in the body.
Every tooth has a nerve meridian, like a track to different parts of the body, right? This tooth could literally be nerve meridian to the right knee. This one, et cetera, et cetera. The liver, kidney, so meaning that your teeth literally are neurologically connected to parts of your body.
We actually go over that at Smile Body with every new patient that comes. We go over all the meridians, which tooth is connected to which organ. Very critical.
So she had infection, I said down back here, the back molar region, that's on the meridian of the heart. Okay. So she had heart palpitations for 20 years, debilitated. She could not even function anymore. She found you. She went to the Pompa program. So now she was doing better, right? She was doing better, but still having the heart palpitations. So you sent her to us. We did this assessment. We sit down. We had a heart-to-heart conversation about this. And so she trusted enough to move forward. We did a huge surgery, removing a lot of infection. The day of the surgery, literally that same day when it was finished, her and her husband, I saw them hugging in tears because they were done. She said, it's finished. I'm not feeling it anymore. So, I mean, this connection, the mouth-body connection is in so many ways. A lot of people think about, if they've heard if there's an infection in the mouth, it could be dangerous. It could lead to your heart and you could die. Yes, that is true. But it's not just about that. It's not just for the bloodstream, the lymph, the neurological component, the meridians. These are all things that are big components of our health that is completely overlooked.
Overlooked. When people get that, they get this hidden infection out. And again, I want to press this further. Most people have no pain, no acknowledgement ever, or they go to their dentist, it's fine. They don't know that these cavitations exist. Literally, it's where typically these are where teeth have been removed in the past, like a wisdom tooth. Here we are 20, 30 years later. It's healed over. There's no pain, but yet there's infection in there that can really screw up these meridians and dump these,
Nobody knows really what cavitation, you're bringing awareness. It's really critical. We talk about it all the time. Most people, when you say cavitation, they're like, what, cavity?
Cavity. Yeah, it's not a cavity. It's not. This is an infection in the jaw. But let me finish this point, though, right? Because people don't know they're there. But, these things are, number one, releasing toxins into the bloodstream 24/7. It drives a lot of autoimmune. And then this nerve meridian. So when people get this immediate change. So a friend of mine, I sent him to Dr. Jerry in New York, right? He had 21 years of debilitating liver pain. This guy had the money to go to every doctor, and he did. No one could figure it out. He had pain throughout his body as well. He gets the cavitations. They did a cone beam. That's how you look for these things. We'll talk more about that in a minute. But he finds 3, 4, I can't remember exactly, cavitations, right? Didn't know they were there. He leaves Jerry's office. I get a text. Hey, Dan, my pain's gone. Wow. My liver pain's gone.
Yeah.
Is that just crazy? Is it going to last? I said, I don't know. We'll find out. Okay. That was like 9 years ago. Okay. So still no pain. But the point is when I hear that where it clears immediately, that was that nerve meridian thing. Right. You know what I'm saying? Because we didn't clear the toxins out of him yet, but that nerve meridian was broken and he had instantly. I also hear stories about people saying they're in the dental chair and as these infections coming out, they say it feels like they were reconnected. I can't tell you how many people told me that. I feel like I was immediately reconnected to my body, and they describe it as a spiritual thing. That's a nerve meridian.
You know what? This is interesting. This point you just made right now. In our office, when we're doing surgeries, we like to make sure the patient is really comfortable. So we do some kind of sedation for them, either pill form sedation, other kind of sedation, to get the experience. A lot of people avoided these procedures because of the anxiety.
Yeah, they're afraid of dentists. Yeah,
and
dentists.
Yeah, they hate the dentist, right?
Yeah,
so we make sure the whole
scary
experience is like like it never happened. Kind of make a comfortable experience. And I was having this conversation about sedation dentistry, which we've been doing for 20 years.
Yeah, I think it's
we help
critical
patients so much. You see patients that would never go to the dentist anyways. So that's a whole other story. But here's the thing. I was having this conversation with a good friend of mine. You met him actually at A4M, Dr. Dome, right?
Oh yeah,
Mm-hmm.
Yep.
So he's a leader in the industry, right? He doesn't believe in doing sedation. So he does all his sedations with the patient just numb. And I told him, like, Dome, why don't you do the sedation? The patients are uncomfortable. They have anxiety. You'll help a lot more people if you do it. And he's like, no.
He's going to start doing it.
No. His reason is he said that, he wants the patient to actually have that experience that you just talked about. So when you're in it, when you're there, you actually start feeling immediately different while he's clearing out the toxins. You actually feel it right then and there as it's happening. So he says they need to feel that. They need to feel that experience. So for him, German kind of
it's a different philosophy.
Comfort is still different.
I don't want to get too far down a rabbit trail here, but good old Hal Huggins, he was the father of biological dentistry, if you will, right? Lost his license, criticized all the time, but he said that you couldn't cross the midline because of these nerve meridians. Neurologically, don't do work here and then over here at the same time, even remove amalgam fillings. But when they would sedate people, you could cross the midline. So what it tells me, though, is sedation takes enough stress off of that that it's worth doing.
That's my philosophy.
Yeah. So I'm a fan of sedation, thinking about Huggins' work.
Yeah.
And I've watched thousands of people go through this. Again, I send more people to dentists than anyone. And I can tell you, sedation, I think, is the way to go.
I mean, at Smile Body now, we have all forms of sedation. We have 7 anesthesiologists. We have oral sedation, which everyone's sedated. Yeah. I would say, 80% of the patients are...
Is your whole office sedated? Like, everyone's just laying around? Yeah.
We're just very relaxed. We're very relaxed people.
Everybody's sedated.
Everyone's very relaxed.
I don't know what happened to Mary? Oh, she's sedated.
Here's a pill for you. Here's a pill for you.
We can't get our staff do anything because they keep sniffing the sedation. Yeah.
No, but to your point, I always tell patients, sometimes, our patients are anti-medicine that come to us. They're trying to avoid prescriptions for good reason. And we are too. We're avoiding prescriptions. But what I tell my patients when they have a little, anxiety about doing sedation, in general, they have anxiety, but they have more anxiety about doing sedation. So what I tell them is that you have to realize this process puts stress on you. The stress on the body is not just physical stress. There's emotional stress, and what that does is there's certain cortisol hormones, stress hormones that are really released during that process that affects your recovery. This affects how you are, this whole process affects you. So when you are going through that process in a relaxed state, like you just said, the Huggins example, for example, it affects your recovery. It affects your outcome.
Yep.
So I love that patients can come in and come back the next day and say, and I'm like, how'd you do that? I'm not even feeling it.
Well, exactly, and that's what I've seen. That's why I'm a fan of it. And by the way, I at some point I do want to give you a chance. You should see their office. I mean, you do have probably the most high tech dental office. Everyone I send their comments like, "Oh my gosh!" I mean, you have hyperbaric chamber, you have ozone, you have everything, red light therapy. You name the biohack for healing and recovery, y'all have it and do it. So, no, your office is immaculate. It's amazing. I mean, you would not believe it's. I always feel proud, sending somebody there because they're always like, wow, right? Mark Dante was like, that was the nicest dental office. I'm leaving my dentist. Right? Oh, and by the way, I was just with him last week, and he fired his old dentist, right? Because he went in and he said, you told me that tooth was fine. Oh. You told me it was fine. It wasn't fine. I saw the infection he pulled out of there. Yeah, the dentist was still trying to justify it. He's like, yeah, well, you know what? Me and my family aren't coming here anymore. It's like, but how much of that happens, right? Where this guy had he had major infection.
And I don't blame the dentist, honestly, because they only know what they know. Only thing I can blame them
Good
for,
point.
they're not doing, it's not malice, and listen, we were that dentist. I don't want to vilify dentists, because you only know what you know. But at the same time, the only thing I can say about dentists is that you have to keep growing. I mean, listen, if you're not growing, if you're still doing the same thing you've been doing since dental school, I'm sorry. Then you're not doing your best.
Question them, right? I mean, come on, question your governing body, for goodness sakes.
They're doing the same thing over.
I know.
Over again.
They told you amalgam was safe. The rest of the world's banning it. Come on, maybe it's not, right? Let's talk about fluoride. Okay, so 2 states, right? I mean, we're hoping that this gets banned across the U.S., right? I mean, this is absurd because I mean, fluoride literally. It's like talk about practicing medicine without a license, or not practicing medicine, consent, with no consent to give me something that potentially could harm me in the water.
That's how they're getting around it. That's how it's getting banned, because they're putting a medication.
They're putting a medication
in the water.
In the water.
Yeah.
Now, here's the problem that I have. They used to say you could probably maybe 11.2, nanograms or something per liter of water was safe, whatever the number. I don't remember the exact number. And then I watched it go from that to this, to this, to this. I mean, just in the last 20 years, it keeps getting less. Why? Because more and more studies come out and they go, whoops, we better lessen the amount. Okay, first of all, they don't know how much water little Tommy drinks a day. Might be more than, little Amy over here, right? You know what I'm saying? So how do you know how much is safe? And then how do you know how their body's dealing with it versus hers? So this is why we don't give medications like this in water.
Why would you put physiology is different?
Why would you put something that has a skull and X marks, that on it?
Yeah.
Like, literally in the water, in the tooth, something that you're putting in your body should not at all be have any level of toxicity at any amount.
So Bobby Kennedy's position is, hey, look, we should stop putting it in the water because of the studies. Another study just this past August showed like even more disturbing results, with IQ. I mean, just dropping IQ in children. Obviously, many other studies, bone cancer in boys, et cetera. You guys talk more about it. But okay, so we see this massive drop. He wants to get it out of the water. And he says, okay, if you want it in your toothpaste, you can choose that, right? So that's his stance, right? If you want to choose it, you choose it, but we're not going to just put it.
That's the right thing to do.
I think it's the right thing to do.
Right thing.
I mean, I think.
Why do you even have it in water?
Informed consent. I mean, you have to know, you have to be able to choose whether with any medicine that you're putting in your body.
Absolutely.
You have to
Choice.
have choice. Nothing should be mandatory. Any medication, any medicine.
So what about, there's dentists that are going to say, because they're going to say, yes, but it works. It prevents cavities, and the studies show that. What do you say about that?
Better ways. The thing is that what we talk about Smile Body is that we don't use fluorides on teeth, okay? Because like you said, the effect is so minimal. Instead, we talk about micronutrients, because now everyone's micronutrient deficient, right? We all are, right? So what happens is if you're having the right micronutrients to pull calcium into your teeth properly, you're not going to get cavities.
That's right.
So no one talks about that. Instead, they're talking about fluoride, right?
But what about the deficiency in fat-soluble vitamins? Meaning, if you don't have normal K2 levels, which people don't because you get it from grass-fed, fatty foods and things, people don't eat that, right? So they lack K2, and you need K2 to move calcium into the bones, which is the teeth.
I mean, to your point,
Give a point for that.
I mean, at this point, we have to change how we think about healthcare and medicine altogether, right? This concept of fluoride, putting something on your teeth or from externally to make it better, that's thinking backwards. What we believe in biological dentistry and holistic medicine, integrative medicine, is that first of all, you have to get healthy from within. Bring balance from within.
Unhealthy people get cavities.
Yes.
How many people do you know that have been coming to the dentist and they've been putting fluoride on their teeth for how many years now, and they still have cavities?
Yeah, they're doing fluoride, they're brushing and they're flossing.
Same technique.
But this principle of fluoride, brush, floss, and you'll be okay. But that doesn't work, because what it is, you have to go look deeper. Look at Weston A. Price's research.
Just going to bring it up.
So Weston A. Price, for the people that don't know, This is something I bring up every day. I have a few books that are in my reception area. His is one of them, because these are the basic principles that we should be.
Explain what he did and
Yes,
what
I'm going to get into it. Right? So he was a dentist in the 30s, and he wasn't just a dentist; he was a researcher. And what he believed is, you know what, I have to figure out why dental disease happens. So what he decided to do is to go into villages where the people were not introduced to westernized life at all.
Yeah.
You know, the indigenous people that had lived like hunters,
extraordinary health.
gatherers,
Yep. Mm-hmm.
you know, and what he saw is they had not only extraordinary health, but their oral health would not only, they didn't have cavities, but they had full straight teeth. They didn't have to get their wisdom.
And I witnessed this myself in Africa.
Yeah.
I was introduced to a tribe that recently just came out of the mountain because of drought. And, you know, I was like the first white person they ever saw. But what I saw was extraordinary children with perfect teeth.
Yeah, really.
And they didn't have cavities. Matter of fact, they didn't have a name for cancer. It didn't exist. Heart disease didn't exist. I mean, now, none of these, osteoporosis didn't exist. And the question that was asked to me by one of the people that brought me there, he said, this tribe barely eats, but yet they have no diseases compared to the other tribes that were more modernized by World Vision, et cetera. And I was like, well, no, they eat. It's just because they were refusing any help or any inside food, but they had perfect teeth, man.
Exactly.
So, yeah.
So when he saw this, you know, he's like, this is amazing. What are they doing? They're just living their lives without the westernized system. So what happened was then the westernized system was introduced to these same villages, and he would go back and visit with them and then chronicle what he saw. And then if you grab his book, you can see the pictures of before and after on these poor souls that were now rotting teeth, crowded teeth, misaligned teeth, no room. Now, so a lot of times people say, like, do you have to get your wisdom teeth out? This is not natural, getting wisdom teeth out.
Absolutely.
It's not natural. It's not natural that we need braces, that we're getting cavities.
Yeah.
You know, just processed foods.
So it's this concept of that we need to add fluoride externally to our tooth to get it healthy. It's backwards.
Half-ass backwards.
It's
Absolutely.
backwards.
Yeah.
So that's my answer. So healthy from within.
So what are the talk about a little bit of the poisoning effects of fluoride, right? You know, I mean, it's not what people think. I mean, we're just kind of throwing it out there that's bad, but why is it bad?
Well, it's a neurotoxin, right?
Yeah.
I mean, there's so many things. I mean, so many studies that you talked about IQ. I mean, I was on a podcast and they're like, "What, fluoride's bad?" I'm like, well, do you like your IQ? I mean, is this important for you? I don't know.
It's not our opinion. It's fact.
It's not opinion. Mm-hmm. It's not opinion. So, I mean,
the research is there.
It's not a conspiracy theory at this point. And to say, let's say there's even I think the concept of is strengthening the teeth, you can make an argument for that. Sure. But at what cost? And there's better ways. We just talked about the better ways.
But it makes the teeth harder but more fragile, almost glass-like.
I mean, the thing is, and the problem is, Dan, is you're getting on so many different levels in everything now. Like you said, in toothpaste and water and different sources. I mean, it's like over fluorosis. You know, for what? Like I said, we don't need it.
Yeah.
You know, if you do it in a healthy fashion and get in your micronutrients and upregulate that properly to pull calcium in, you're fine.
There were studies done that the way this came about, there were studies done that said that, you know, you can prove that topically, fluoride can strengthen or with cavities topically.
That's why Bobby's approach is, if you want it in your toothpaste, great. You know, I personally wouldn't, because I don't want my kids swallowing it. It's a toxin.
Why would you put something that you can't swallow in your toothpaste?
Yeah, exactly.
But so there is that, but there is no advantage. Even in dental school, they taught us this. Even in dental school, they taught us this, that ingesting fluoride has no benefit. In dental school, I learned this.
Wow. That's shocking.
Yeah. So it was about topical. But even then, like, there's alternatives. You know, there's the hydroxyapatite, which is an interesting conversation to talk about. A lot of times people are looking at hydroxyapatite as the fluoride replacement. But then we have to talk about there's good and bad types of hydroxyapatite, you know. So you have to be, again, for me, it's not looking for answers outside of you. You know, just like anything in health.
Health comes from within. You know, it's like, right? It's, if your child's getting cavities, there's some nutrient problems. There's some other toxic issues. The other thing about fluoride that, you know, you mentioned thyroid cases. just like chlorine, this is a halogen type of chemical, fluoride, that has an affinity for thyroid receptors. And that's why it really does cause thyroid disease. And again, and we're ingesting this.
And people have Hashimoto's.
And the rates are going up, and we're putting this in the water. I mean, by the way, the history of this is a little sinister. I mean, Grand Rapids, Michigan, I think is where it all started, actually, in the 1940s, if I'm not mistaken. But
it was
and they literally, did just crazy study, that showed, that it prevented tooth decay. But it was this stuff is so toxic; it's very expensive to get rid of.
Mm-hmm.
So this ended up helping the aluminum industry and the phosphorus industry, right? I mean, because where the aluminum is a byproduct. And then, hey, because of this one junk study, we can get rid of this stuff and put it in the water and improve cavities. This is where it came from.
Yeah.
I don't get it. I really don't get it. That's why
that literally is the story.
Yeah.
I'm glad you shared that. It's literally a story. How do we get rid of this stuff?
Yeah.
And it was like, hey, if this study says it's good for your teeth, let's just put it in the water.
Yeah.
That's it. And that's where we are now.
Yeah. And we've been dropping the levels ever since because, whoops. It's okay. We need to ban this stuff. So I think we're there. Okay. I told you we were going to peel apart all these just flaws in dentistry, right? I don't think we have enough. Yeah, exactly. It's like, okay, we went, Mercury. We went through Mercury, right? Big problem. Only country in the world still calling these silver fillings safe. And then we talked a little bit about infection.
Yeah, we talked about cavitations.
We talked about cavitations. These are after you get teeth removed, they heal over and they can form these caves called cavitations. These are infections in the jaw that you don't know are there. The only way to know, because people are saying, well, how do I know? Because it's 80% that if you had a wisdom tooth out, you have it conservatively.
Research actually is that it's more.
Okay.
It's conservatively.
Yeah, I would think it is more.
I really think we should talk about this a little bit more. Then,
okay.
Because most people don't really realize what cavitations are. So like you said, as a surgeon, I was doing oral surgery most of my career, right? I would go back there. They told us, pop out the wisdom tooth out, put some stitches, and you're going to be a chipmunk for a little bit, and you go home and you're going to heal. And you do, right? Unfortunately not, like you were saying. The top layer of that area heals. The inside of it just becomes a dead, bony area.
Because it's very difficult to build vertical bone, as we say, right? Meaning bone to fill the hole.
It's very hard. And then because one of the reasons is because we're micronutrient deficient at that age. Mm-hmm. When you're, in your teens and 20s, that's the biggest thing. So you're not pulling calcium properly, and it just becomes a little hole in the jaw, right where the wisdom tooth was. Yeah. And what's in that area? Parasites, bacteria, heavy metals, mercury resides in there.
Everything.
And when we go in there, and the treatment for that is we're doing that with Ben all the time, and with our surgeons in the practice, we open up the area and it's just mush, fatty tissue, dead brown blood,
toxin load. And by the way, with new testing, we're able to test. Yeah, not you all are able to test what's in there. You're finding parasites. You're finding deadly anaerobic bacteria, like lists of them. Yeah. Oh, no wonder people can't fix their gut. No wonder they can't shut down their autoimmune, because these guys have a little cave that they hide in from your immune system because of the lack of blood flow. And people are taking all these parasite killers, pathogen killers, candida, fungus killers, and they're hiding right here.
Yeah. Well, a lot of times people say, well, why is it the body can't heal itself?
That's right.
But here's the thing. It's unnatural to be doing this in the first place.
That's the point.
To be pulling the teeth in the first place.
Yeah.
So your body goes into a state of shock of not knowing what to do in that moment, especially, man. And then there's two components to this of why this happens. A lot of times patients say, why am I getting a cavitation in the first place? And Shawn mentioned the first thing is your body being prepared for healing. Nutritional deficiencies are such a big component of it. So
vitamin D, vitamin K2, and minerals.
Magnesium, zinc, drivers of calcium going into your bone to heal. So not only that, just overall, like you said, fat-soluble vitamins, right? So the diet is horrible, especially at teenage years.
Oh, the
Eating
worst,
horribly.
the worst.
So, and then you're macronutrient deficient. So, and then the practitioner, that's a component too. So what you do if you do have to pull a tooth, okay, no, we have to pull a tooth sometime, right? It's dead, it's
Right.
dying. We'll talk about dead teeth probably at one point, but dead dying teeth are a thing. So we can't let a dead dying tooth in the jaw. So we have to pull a tooth sometime. But what we do at that moment of cleaning the bone properly is very important. How we clean the bone, we have to clean the bone properly because there's ligaments, there's
And if you leave that behind,
yes,
infection just right.
Yeah, so that helps create those cavitation areas as well. So you have to clean the bone properly with ozone, lasers. There's a whole protocol that's actually has to be standardized in dentistry, which is not. And then from there, what we do to help the body rebuild the bone, which is, I know you know this well, because when your patients come in, patients of the Pompa program, they know, they watch the videos, they understand, they know what PRF is, platelet-rich fibrin, which is using your own blood.
Yep.
We centrifuge it. We get growth factors like actual stem cells from your own body, and you infuse that with certain kind of materials like bone grafting materials that actually go help your body now heal in that
build
area.
that bone.
And so your body has to be prepared beforehand. And then on the day of the surgery,
what are the micronutrients that we just talked about?
Yeah, because back for a while when this work started to come out, they were just going, oh, we'll kill the bacteria. Ozone, we'll kill it, right? But you realize if you don't build bone, they just keep coming back. It's like there's a cave full of all these nasty animals, right? We go in with the cave and we gas them out. Then we kill them and they run out. Okay, great. Look how clean the cave is. But in a few months, the animals just migrate right back.
And actually, in that scenario, now we know it actually can cause problems. Because what you said, it might run out, right? They might move from that space somewhere else.
Exactly.
So it actually could cause problems.
Happened to me. I had some work done here and the bacteria went from one space to another space. I had all this inflammation up there. And I said, hey, did you do anything up here on this top left? No, I didn't touch that. I'm like, yeah, I didn't think you did. And I had all kinds, they just ran to the next hole. So this has to be done correctly.
The exciting thing about cavitations is that right now there is actually a lot of research. There's a lot of research that's happened in the past, but there is a amazing doctor. His name's Sharon Gallinari from Germany. He actually is working with Tufts University to do current research on this.
Praise God.
That is going to be published more and more right now. So this is going to be more of a mainstream, like research-based, like school research, in the United States. So this is going to be more and more mainstream coming up soon. So more excitement coming.
Yeah, that's great.
I have to say one thing that we're not talking about. We're talking about the dental aspect of things right now. We're not talking about one more thing. We talked about meridians, right? So when you have a cavitation in wisdom tooth area, that blocks the meridian that we were just talking about.
Right, exactly. And then if that's connected to the heart,
that meridian exactly connects to the heart
that we talked about,
connects to the adrenal glands, right? So a lot of people have adrenal gland fatigue. So whenever I bring that up, they're like, oh my God, that's me, right? I have adrenal issues, and shoulder issues. If you follow that meridian on the wisdom, there's so many issues that's blocked because of that cavitation.
My frustration with our maybe my space in functional medicine, alternative medicine, more and more attention is going to this fancy test, SNP test, microbiome test, all these. I'm an MTHFR homozygous, and they're on all these supplements, all this. It's like, but I still don't feel well. I still have this. I still have this gut problem. I still just don't have energy. Did anyone do a cone beam to see if you have a cavitation? No. I feel like I'm the only one in this space shouting from the rooftops, check their microbiome, check their oral microbiome, check their cavitations, check their, check here first. I have people that have been to the best functional medicine doctors. They still have a damn silver filling in their mouth. I'm like, what? It's like your body won't even let go of toxins with that filling. I mean, it's like, come on.
That's why, we're trying, that's why we're trying to get this message out, Dan. I was just speaking with the head of the Naturopath Society for California, where these are the people that are putting the conferences together for the naturopaths, not just the regular MDs that are kind of tunnel vision. Sorry, MDs, but The naturopath,
I know.
are
Yeah.
the ones that are thinking holistically, looking at the whole body. She had no idea about what we're talking about.
I know.
Yeah.
And I say this
You're a
respectfully.
pioneer. After I understand,
You're a pioneer. You really are. You're
we
top of the road.
We talk about this all the time at the office. That when I talk to patients, I'm like, Dr. Pompa was one of the first people that actually I met that says, I cannot detox your body if you do not go get a cone beam to make sure there's no toxicity down to your mitochondria. So you're not going to have inflammation. So you can detox as much as you want, but if you're not looking at the oral cavity, it's not going to happen. So you're one of the first people.
I mean, it's like the bathtub's overflowing, causing all this damage upstairs. The water's gushing in, and we're down here trying to get the drains open, right? It's like, no, first thing you got to do is, let's shut the water out.
Down.
Yeah, exactly. Put towels, mopping. It's like, wait a minute, can we just shut the valve off? Can we shut the spigot off? Oh, okay. Because these infections, these cavitations, and we haven't gotten to root canals yet because how many people have those? I think of like this young generation, right? Right here. How many of them have had their wisdom teeth out, right?
Absolutely.
80-90% chance they have hidden infection that's going to start giving them symptoms 20 years down the road, right? That's when it happens, right? Then their immune system is now challenged. And then all of a sudden they're diagnosed with whatever condition, right? You name it. Never thinking for a minute that it happened 20 years ago, 25, 30 years ago when they got the wisdom tooth out and now they have a hidden infection without pain. So it's the connection is never made. You know how many times I see that? And that is what frustrates the hell out of me, man.
It's reality. And again, the good thing is that, things are shifting. But I commend you, Dan, for kind of, because of personal experience, you said it says pain to purpose. This is your purpose. I really do feel like to create this shift that's happening right now, you're a big part of that. We're doing our part. I really appreciate your message.
Yeah.
And then from the first moment we met, there was alignment. And this is it's a beautiful thing that's happening, that more and more people are questioning things now.
Yeah.
And asking questions. You can't just blindly follow.
And I'm grateful for you all because you're leading the way on the other side. We need more of you out there, right? We need more of you out there. Let's talk about root canals. This is the same concept of hidden infection. You don't know they're there. When you take a dead tooth out, what they leave behind is all these microtubules that fed the tooth. So a root canal is where they take the infected nerve out, right? Mm-hmm. But this is left behind, and now we know that there's all these bacteria that are in there. And this was years ago. A guy named Boyd Haley, University of Kentucky, he had all the biological dentists send them root canals that were extracted. Now, it had to be a safe root canal or a non-infected root canal, meaning like no problems. If it was known to be infected, didn't make the study. These were like root canals that were taken out because they, people just didn't want them in anymore, right? They sent them to the University of Kentucky. They found 100% of them had nasty anaerobe bacteria in them. Talk about root canals. Why are they dangerous? You and I did a thing on this at blew up 10 million views.
I mean, you mentioned the cone beam CT scan, which is critical.
Right. This is how we see these infections.
And a lot of people don't know what a cone beam is.
Yeah, you might want to say that because this is not a normal x-ray. Yeah. And this is the other thing I found. Even if they had a cone beam, the dentist doesn't have the right software. They read them as plain films. Yeah. And that's a big problem too.
They don't know how to read them.
They don't even know how to read them.
Dentistry is about two-dimensional x-rays, which is great for cavities.
Yeah,
right?
Absolutely.
You want to find a cavity, two-dimensional x-rays are fantastic. A cone beam, people don't realize, if you really want to find hidden infections, like you're talking about cavitations, root canal infections, different kind of infections that we find, you need a cone beam CT scan. And not on any cone beam CT scan. Like a lot of times, like functional doctors or even yourself, they patients from your company that are coming in, some of these machines are really old. Yeah. So have a proper machine that we can read. And when we go there, we find a lot of hidden infections, like you're talking about root canals. Listen, we want to save the tooth if you can. It's wonderful. You want to save the tooth. But a lot of times what happens is, like you said, you can't clean out all the bacteria. They all get infected at some point. And if you have hidden infections that you don't know about, that's introducing toxicity into the body. And it creates microtoxins being released into the body all the time. And they have no idea where it's coming from.
Do you believe a root canal could be done safe?
Well, here's to your thing is like this. I think there is a place for root canals as far as a temporary solution
Right.
to get out of pain.
Yeah.
Okay, I can see that. Or adolescent that you don't want to pull the tooth right now. Like we have to control the pain situation.
Mm-hmm.
It's a great temporary solution as a pain reliever.
Yeah. Knowing that, in
It's
short time, it's you know that it has to come out.
It's not in my mind. Listen, you're talking to two people that had extensive training and to do root canals beyond what we learned.
I'm great at it.
You would say you would take pride in looking at those X-rays and say how well we did them and so on and so forth, and found extra canals that were missing. So we were passionate about doing a great job in root canals, but then we had to look at the research. We had to again keep evolving, and for us at this point in our career, we decided there's no way we're going to do root canals anymore for patients because we don't feel like it's actually doing the right thing. Now, when patients, let's say the nerve is dead or dying, okay, we tell them, this is my philosophy. If you want to do a root canal, there's a local root canal specialist I'll refer you to. He's an outstanding dentist. I'll refer you there. Go do a root canal. But I want my patients to be their own health advocate. They have to understand pros and cons and any informed consent decision. Mm-hmm. And they have to decide what's right for them. And if they're informed properly, then you decide. Think about it.
Right.
Does this make sense to you?
Exactly.
A lot of times when I tell my patients a philosophy of how a root canal is done and why we choose not to do it anymore in our office anymore, they say, well, that makes sense to me.
Well, I mean, the thing is that my philosophy is that your immune system cannot regulate that dead organ. That's
true.
The problem. So people don't realize right now, let's say your body right now, all your cells are functioning properly. They're alive, right? And your immune system can regulate it with your blood and meridians also, right? So when you have a dead structure, it's the only time that
throws that meridian off.
Throws off the meridians. So root canals block meridians. So now we have a blocked meridian. Metals block meridian. And also, it's a dead organ sitting in the jaw. A lot of people don't know this. They eat our organs.
Yeah, exactly.
We're talking about that.
They are.
Blood supply, cut off the nerve supply, cut off the limbs.
Sitting there. It's sitting there in the jaw. It's a foreign body now. So the body cannot regulate it. And like you said, anaerobic bacteria goes into the tubules, produces toxins, and a lot of them at some point get infected.
Yeah.
Right? Maybe not 100%, but a lot of them get infected.
Yeah.
People don't know. Yeah. There's no pain.
Did you see the movie The Root Cause?
Of course. This is required viewing for any of our patients that before they come.
They took it off Netflix. I mean, because it was disturbing to the ADA, right? It's like, but what a story of, again, I hear these stories all the time, right? Of people, can't figure out what's wrong. They have all these symptoms, crazy symptoms. Get a root canal out. Oh my gosh. It's like, reconnected to their body.
I should send the link to every new patient.
Yeah,
you have to watch it.
That's smart because stories really sell, right? Meaning they get people to understand the damage, how damaging. When I was sick, I got my root canal out. I didn't care. I knew it. I read it all about it, the problems. I'm like, it's done. It's done. So I took it out. Yeah.
It's low-hanging fruit as far as source of toxicity. Yeah. When you're trying to cleanse your body of any kind of shut off the valve of the water that's coming in, it's low-hanging fruit. Yeah. So I think for people that are sick, that are unhealthy, you have to immediately get a colon scan.
Absolutely.
Everyone should.
We almost make it mandatory in our program. It's like, look, because I'm not playing around. Again, when I tell my doctors this all the time, you all hear me say it. If someone's not getting well, there's something still upstream causing them to be sick. Look here. Look in their homes, right? Like, homes are another one, right? Hidden mold, hidden VOCs, et cetera, et cetera. But, but again, functional medicine is not doing this. They're not looking at causative factors. And this is one of the number one sources.
No, they're giving supplements all the time.
Let's tell people, I think we have to finish on this note because people are going to say, well, wait a minute, hold on a second. I can't get a root canal. What do I do then? Mm-hmm. Or if I get this tooth out, what do I do? Well, wait a minute, right? It's like, what if I have one of these cavitations and they get in there, so what do we do for teeth?
Well, I have to tell you, one of the most important things then, at this point in my career, I never tell patients at Smile Body what to do, right? We collaborate, we educate, we give them information to read, and then they tell us what they want to do with their body. So if they like, Ben
They're
was
the
saying,
drivers of the bus.
if they elect, they say,
Their
you know
body.
what, I want to get a root canal. We have referrals that we send. Okay, no problem.
Yeah.
You can go get a root canal. But most of our patients that we see, they elect, they want that dead organ out of their body, right? They're saying, I don't
People
want.
just don't know.
right?
They just need to be told.
That's what, so they come educated. They tell us, listen, Dr. Shawn or Dr. Ben.
All my people come educated, man.
Your videos are incredible. I mean, I don't even know how you had time to make all these videos, but
Well, we need one of them. We may
I
not
know. I always ask them, like, have you watched Dr. Pompa's protocols? And oh yeah, it's amazing. I watch her. So you make it easy for us. So when we talk to them, they're educated, they understand, and they tell us, they're like, Dr. Shawn, I want this out of my body. Okay. So what's my option? So that's when we talk about the option. And the option is, at this point, we're putting in zirconia implants.
Yes.
Right? We don't want to put titanium implants in because, again, titanium pulls in EMFs.
Yeah,
one, like
exactly.
we talked about, it's an antenna. So
I always
through
say that the brain hates metal, honestly.
all metal.
Yeah, it hates metal. Titanium is immunosuppressive, and it does form biofilms. I mean, there's issues with it. I refuse to do it. So I put a zircon bridge in because back then, this was a long time ago, we didn't have a zircon implant as a choice. But that is a good choice today, correct?
and it doesn't block the meridian.
Right.
Forget, the meridian stays open. So electricity goes through zirconia. So I always tell patients.
And just to be clear, zirconia is more like a ceramic. It's a non-metallic.
Not zirconium. So a lot of people,
Zirconium oxide.
it's
Zirconia.
Yeah. And here's the thing. And yes, we did probably thousands of titanium implants, and they're not all titanium. There's more metals in there. Titanium is just the number one by far ingredient as far as what's made up of that implant, but it's not only titanium. So again, that's contributing to your heavy metal toxicity, meridian blockages, attracting those EMFs that we just talked about. So all those factors are important in metal restorations that we should be avoiding in the mouth, titanium implants being one of them. Better alternative, of course, now we have ceramic implants. Ceramic implants have been around for over 20 years. Most people don't realize it's gone and improved over the years.
Absolutely.
Shawn and I have been placing them for how many years? I don't know, a lot of years. We've gone through a lot of different types of them, actually. Looking at the different brands, looking at what's the best way of doing it. Now we've settled on, over the past few years, a brand that's out of Switzerland that is, by and large, head and shoulders above any other type. It's called the SDS, Swiss Dental Solutions.
Okay.
This type of implant now, when we put it into the body, we're using with PRF, they actually now not only to get bone integration, but the gums attached to it, and
Beautiful.
Wow. Yeah. So that's the key, and this is where dentistry has to go to.
It's the future.
Yeah. This is the future. I'll tell you.
Dental and medical together.
I know.
You
We didn't even talk about galvanism. That's when you have two different types of metal in the mouth, like a titanium implant, and you have a crown, and it creates a literally a battery-like effect, a current that your brain hates. When my gold filling came out and my silver fillings, literally when that galvanism stopped, so much of my anxiety went away.
Yeah.
It was like this.
Release.
I mean, how many people have opposing metals in the mouth? By the way, opposing metals, two different types of metal in an acid, that's called a battery. That's a battery. You have a battery in your mouth. Oh, and then you add a cell phone to that? Okay. I mean, listen,
Because and they have metals. Don't forget, you have that gold, and then they have a mercury filling underneath.
Oh,
yeah.
So now and that mercury's pouring out 10 times faster than normal mercury going into the brain.
Because they treat
This is what
that's what
dentistry has done.
That's what I was going to say. Dentistry is about treating the body, like the head, like it's a tabletop. Just hammer it, fix it, and put anything you want in there, and it's fine.
Go.
It doesn't work that way.
No. Well, Smile Body, right? This is connected to this. I love your name. I love your concept. Give them your information again. Let them know.
My Smile Body, that's the word they can find us. That's our Instagram. And so at My Smile Body, and it's incredible. I mean, honestly, you've been there, and it's a 7,000 square foot center that we put everybody through the healing modality all at the same time. Your head, your body, IV centers, biohack equipment.
You should see this.
Healing went down. And we actually ran out of space after it's 7,000 square feet. We ran out of space.
Healing.
Yeah.
These current technologies, IVs, red light, hyperbaric energy healing, light healing, oxygen.
It's amazing.
It's the next chapter.
Amazing. And they do my work too, right? So we're going to make America healthy again, aren't we, gentlemen?
We're trying.
Yeah, absolutely.
It's an effort.
Man, we could talk on, right? It's like, we'll do a part 2.
This is RY Dentistry, and we're following your path because you're so incredible pushing on the other side. So we're trying to push from this side.
It's a team effort. We appreciate it.
Yeah, it is a team effort. Can't do it without y'all. So we're changing the world. We're making America healthy again. All right, folks, another amazing episode of Dr. Pompa Podcast, From Pain to Purpose. Listen, you need to share this episode because you know how many people are sick unknowingly that's connected to here? They don't know, right? They could have a hidden infection, of course, mercury in the brain, all these things that we discussed. So please like and share the episode. But more importantly, stay tuned for more because we're changing the world, right? We're going to be bringing more topics like this to the Dr. Pompa Podcast. Thank you for tuning in.
Thanks for having us.
Yes, awesome. Yep, that was awesome.
Thank you, man.
Yep.